In the 2013 sci-fi hit Elysium, healing machines zapped away diseases faster than your Wi-Fi buffers a cat video, a concept that felt as distant as flying cars. Fast forward to 2025, and while we're not quite zapping away the flu yet, we're closer than ever to turning sci-fi into Wi-Fi connected reality. Picture this. Need a new liver? Just hit print like you're ordering a coffee mug online. And instead of AI suggesting what to watch next, it's diagnosing your sneaky symptoms before WebMD convinces you it's something terminal. The road to healing pods is no longer just Hollywood magic. It's a fascinating, sometimes hilarious reality check. Bioprinting. From sci-fi to reality. Imagine a 3D printer, but instead of churning out boring plastic knickknacks, it's creating living tissues, organs, and even bones. Sounds like science fiction, right? Not anymore. By 2025, bioprinting has taken significant leaps, turning this once fanciful idea into a burgeoning reality. Bioink's complex materials composed of living cells and supportive hydrogels are now the star of this show. These bioinks are tailored to mimic the extracellular matrix, which provides structural and biochemical support to cells. In simple terms, they're the magic goo that helps scientists print things like skin grafts or even replacement cartilage for worn-out joints. The most mind-blowing progress. Researchers have developed methods to print tissues with integrated blood vessels, a critical step toward creating fully functional organs. Think about it. What good is a 3D printed liver if it doesn't have blood vessels to keep it alive? This breakthrough could address the global organ shortage crisis, where thousands of people die each year waiting for transplants. Notably, the Wake Forest Institute for Regenerative Medicine is leading the charge in creating lab-grown kidneys and hearts, bringing us closer to ending the organ donor waiting game. But let's not get ahead of ourselves. Bioprinting still faces challenges, like ensuring these tissues survive long-term and function properly in the human body. And let's not forget the potential for cosmetic and reconstructive surgeries. Imagine a future where you can print a new nose or repair a severe burn with lab-grown skin tailored to your DNA. In 2025, this isn't just theoretical, it's happening in pilot studies across the globe. We might still be a few decades away from printing entire bodies, but who wouldn't want the option to replace a damaged organ like swapping out a cracked phone screen? AI diagnostics. The doctor will see you now virtually. While we may not have those sleek, glowing pods from Elysium, artificial intelligence is rapidly becoming the unsung hero of modern healthcare. Picture this. You go to the doctor with a nagging cough, and instead of flipping through your medical records manually, the doctor consults an AI-powered assistant that cross-references millions of cases and identifies potential conditions within seconds. That's not science fiction. That's 2025. AI diagnostics have proven particularly powerful in imaging. For example, algorithms like those from Google Health can analyze mammograms with astonishing precision, detecting breast cancer in its earliest stages, sometimes better than seasoned radiologists. Similarly, AI tools like Analyze.ai are being integrated into chest X-ray readings in places like South Australia. These systems act like a spell checker for doctors, flagging anomalies that might otherwise go unnoticed. In practice, this means fewer misdiagnoses and faster treatments, which is nothing short of life-saving. But it doesn't stop there. AI isn't just about spotting what's wrong. It's about personalization. AI platforms like IBM Watson Health analyze genetic data, lifestyle factors, and even environmental influences to recommend tailored treatment plans. Imagine receiving cancer treatment designed specifically for your unique genetic profile, no trial and error, just precision care. As of 2025, trials involving AI-driven precision medicine are showing promising results in oncology and rare genetic disorders. Of course, AI isn't without its quirks. Let's hope the diagnostic bots don't confuse your cough for a rare Amazonian flu because you watched a travel vlog. Jokes aside, Ensuring these systems are trained on unbiased and diverse datasets remains a priority to prevent disparities in care. The synergy of AI and bioprinting. The fusion of AI and bioprinting is like watching Iron Man and Captain America join forces, a dream team built to save lives and revolutionize medicine. AI, the genius strategist, dives into mountains of patient data, predicting the best treatment plans with mind-blowing accuracy. Meanwhile, bioprinting is the muscle, creating bespoke tissues and organs tailored to each patient's needs. Together, they're unstoppable. Imagine AI mapping out exactly how your immune system would react to a bioprinted heart. Before the organ even exists, scientists can tweak the bioink recipe to make sure your body welcomes it like an old friend. This isn't just science, it's science fiction becoming real. And the excitement doesn't stop there. Fast forward to 2025, where researchers are working on real-time AI feedback systems for bioprinting. Picture an organ being printed, printed while AI fine-tunes every parameter in real time. From cell alignment to layer thickness, it's like a Michelin star chef perfecting their signature dish. Except this dish can save a life. The result: bioprinted organs with unprecedented success rates, potentially available to thousands of patients waiting on transplant lists. But wait, there's more. The partnership between AI and bioprinting is also disrupting the way we test drugs. Traditionally, pharmaceutical companies pour billions into testing new medications on animals and humans, a process that's painfully slow, astronomically expensive, and ethically questionable. Enter bioprinted tissues paired with AI simulations. These lab-grown tissues can mimic human organs, allowing scientists to test drugs with unparalleled precision. AI then analyzes the data to predict how those drugs would interact in real-world scenarios, cutting down years of research to mere months. Companies like Organovo are already pioneering this revolution by testing new drugs on bioprinted liver tissues. The implications are staggering. Faster drug development, safer medications, and the end of animal testing as we know it. Imagine a world where breakthrough treatments hit the market in record time, where lab-grown tissues spare countless animal lives, and where science and ethics finally walk hand in hand. The future isn't just bright, it's glowing with the potential of AI and bioprinting. Together, they're reshaping medicine, saving lives, and proving that when technology and biology collaborate, there's no limit to what humanity can achieve. Challenges and ethical considerations. While it's tempting to get swept up in the whirlwind of cutting-edge innovations, it's impossible to ignore the hurdles they bring along. Let's start with a biggie: data security. AI systems thrive on devouring vast oceans of patient data to work their magic. But here's the rub: this opens the floodgates for privacy concerns. Imagine your medical records becoming a hacker's bargaining chip. In 2025, cybersecurity experts are playing an endless game of whack-a-mole, trying to keep sensitive health data out of the hands of digital mischief makers. Scary, right? Then, there's the ethical gray zone of bioprinting living tissues. Picture this: a fully functional, lab-created human brain. Sounds like science fiction, but the debate over whether it's acceptable for research purposes is very real. Where do we draw the line? Should we? It's not just scientists, but also lawmakers scratching their heads over these profound moral quandaries. And let's talk about the elephant in the room: cost. Bioprinting and AI aren't exactly budget-friendly hobbies. These technologies are like the Ferraris of healthcare: powerful, sleek, and ridiculously expensive. Making them accessible to the average patient will take a colossal mix of government funding, regulatory intervention, and a sprinkle of financial wizardry. But wait, there's more. Job displacement is the ghost haunting the AI revolution. If AI can diagnose cancer with pinpoint accuracy, what happens to human radiologists? Will pathologists become a thing of the past? For now, experts assure us that AI will act as a trusty sidekick, enhancing, not replacing, human expertise. But as the tech gets smarter, the balance of power may tip, and we'll need to confront these changes head-on. After all, isn't it better to steer the ship than let the tide decide? And that's just a glimpse of the jaw-dropping future we're racing toward. If you love diving into this wild blend of sci-fi and reality, don't forget to hit that like button, subscribe for more mind-blowing innovations, and share this with your fellow future enthusiasts. Let's explore the future together, one click at a time.